thinking about exercises as we started to talk about, there are exercises that are good to do for injuries to your lumbar discs, and there are exercises that are different and good for you to treat lumbar spinal stenosis, which is a condition which is related to getting older and your spinal canal getting narrower. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. So let's start with the older first, since I'm an old doctor, and spinal stenosis is something that I think about. Spinal stenosis, by the way, is when your spinal canal gets crowded by your discs, your ligaments, your facet joints, and as a result, you get some nerve pain, possibly some weakness in your legs. And the exercises to do for that condition are flexion exercises. What does that mean? Bringing your single knee to your chest and holding it for 60 seconds, repeating it once, doing both knees, bringing them to your chest and repeating it once after you've held it for 60 seconds, and also doing what's called a passive hamstring stretch or straight leg raising maneuver, where you're putting a jump rope or strap under your foot and using your arms to pull your leg up without bending your knee to the point where you can tolerate it, and leave it there for about 60 seconds and repeat that. For people who have disc pain or disc pain with sciatica, the treatment's typically different, and this is where we talk about core stabilization exercises and extension exercises, arching your back backwards and strengthening your abdominal muscles and your back paraspinal muscles to tighten your spinal segment and help with that protruding disc and that sciatica. There are passive treatments for disc herniations, which you can get in physical therapy, sometimes in chiropractic, where they'll do what's called spinal traction, where they put you on the rack and stretch you. And in so doing, they distract the disc, and that can be helpful. People do the same thing with inversion tables, where they go upside down, and that provides some distraction for your lumbar disc and can be helpful in sciatica. Just like the passive straight leg raise for spinal stenosis, passive straight leg raising for sciatica from a disc protrusion in the lumbar spine can be very helpful as well. Can do what is referred to as neural flossing, where you're moving your nerve at the spinal segment region to free it up so that it no longer is pinched. When the nerve is pinched, it can swell, and therefore it's like a wetting band when you've drunk a salty liquid and you can't get your wetting band off. The same is true when your nerve gets caught in that neuroforamen, which is the hole the nerve exits out of to the side of the spine. And by doing neural flossing or straight leg raising passively, you can free that nerve up. So those are some exercises that can be done. Again, walking is a great exercise, different than running, which is not a great exercise for your spine because it compresses your spine when you're pressing on your legs aggressively during a running activity. Bicycling can help some people with their spine. It's a double-edged sword because people who have spinal stenosis, for instance, can bend forward and open their spinal canal. So exercising on a bicycle and opening the spinal canal by bending forward can be helpful. But at the same token, if you have a disc injury, bending forward can be problematic because it increases the pressure on your disc and possibly increases the pressure on your nerves as well.